So you have had gestational diabetes, or maybe you've been diabetic all through the pregnancy, and now you've had your baby. What now? Hi everybody, it's Tracy. Welcome to the channel. This is the place where we talk about all things pregnancy, especially if you have a high-risk pregnancy. Today we're going to be talking about gestational diabetes, but I'm going to talk about life after gestational diabetes because, believe it or not, there is life after diabetes, and the diabetes doesn't always go away after you have your baby. If you were diabetic before you became pregnant, then you're still diabetic, but hopefully if you've done a reasonable job of managing your glucoses, then after your baby is born, it gets a lot easier because the placenta has delivered. You're not getting any more of those hormones that make you more insulin resistant. So whether you have gestational diabetes or pre-gestational diabetes, what you should notice right after you have your baby is that your glucose has come right down, and that's good because you'll have a lot more latitude in what you're eating. But remember that even if you weren't diagnosed with diabetes until you were pregnant, there's about a 60 to 70% chance that diabetes is in your future. About 30% of women with gestational diabetes stay diabetic after the pregnancy. The pregnancy just sort of unmasked it. And another 30% of diabetics will become diabetic over the next 5 to 10 years. So even though you do have more choices and it gets a little bit easier to eat and keep your glucoses under good control, remember that you still need to do some basic things to make sure that your glucoses stay normal and that you don't become diabetic as time goes by. Let's talk first about what happens to women who were diabetic prior to pregnancy and now you've had your baby. It could be that during the pregnancy you were placed on insulin, where before you were pregnant you might have been on an oral medication. After you have the baby, depending on what your insulin requirement was, you may go back on a lower dose of insulin for a little while, or it's possible that you might just be able to go right back onto your oral medication, provided that it's safe for breastfeeding. And usually the medicine that's safest for breastfeeding is metformin, and that's about the only one we use for pregnancy. If you were on an insulin analog or another hormonal treatment or another hypoglycemic medication, check with your OB to make sure that this is safe, or your maternal fetal medicine provider or your endocrinologist or whoever was caring for you with your diabetes during the pregnancy and before the pregnancy. If you were diagnosed with diabetes during the pregnancy, if you have gestational diabetes, it might be a little bit easier for you if you were had your glucoses well controlled on a diet, or if you were on an oral medication, or you were on insulin. Probably we can stop your medication entirely after you have your baby. Sometimes you need to stay on a low dose of an oral medication or a lower dose of insulin, but you're much more likely to not need medication after you have your baby. What will happen on this path is that at one of your postpartum visits, you will have another glucola test. Yummy, glucola. 75 grams of glucola, and this will be a 2-hour test. They'll get a fasting glucose, and then you'll drink your glucola, and they'll check your blood sugar 1 hour and 2 hours after you drink your glucola. So if any one of those 3 values are elevated, then, my friend, you have diabetes. If your testing is normal, then since there's a high risk of becoming diabetic over a period of time, every year or two you should see your primary care provider, or maybe your OB provider can do this for you. Do a test called an A1C. We've talked about this before. An A1C is a blood test that looks at your average blood glucose over about a 3-month period of time. And if this is creeping up, if it's more than 5.8, 5.9, if it gets into the 6s, you really need to start watching your diet again. For both pre-gestational and gestational diabetics, watching what you eat, remember, is still important. It just gets a little easier after you have your baby. So remember the basic concepts: fairly low starch and carbohydrates and lots of healthy fats and proteins. And if you do that, and if you stay active, then the future is a little bit brighter and safer for you, and there's a lower chance that you will become diabetic if you had gestational diabetes. And if you have type 2 diabetes, there's a very good chance that with these good habits and healthy movement and exercise that you might be able to kick this all together. Just remember, whether you have pregestational or gestational diabetes, that diabetes is in your future. It gets easier, but you can't completely forget about it. It always has to stay on your radar, and you have to be mindful about what you eat. This is so important for you, but it's important for your kids and the rest of your family too, because remember, diabetes tends to run in families, and if you are eating healthy and you're modeling good dietary behavior for your kids, they're a lot less likely to have problems with obesity and diabetes too. Thanks so much for being here. Tune in. There's more great information about diabetes in pregnancy and pregnancy problems in general. If you like what you're seeing, tell your friends, and it helps me a lot if you subscribe to the channel. Thanks a lot.